The Epworth Centre for Immunotherapies and Snowdome Laboratories is a really exciting place when it comes to developments and advances in blood cancer. Clinical trials are absolutely pivotal to keep the progress rolling.
We've really grown to become a beacon of light for our blood cancer patients. I'm really confident that all our blood cancer patients that come through the door will have access to what they need. We want to give them the best hope for their future and also for others that will be suffering from the same diseases. There are a couple of ways that patients can be involved in research at the centre, one of which might be that they consent to have a little bit of their sample taken so that we can store that, so that we can look at the research down the track. One of the other ways is that they may have gone through a series of treatments and their disease is either not responding or it has come back, in which case they may be eligible to go on a clinical trial.
The Haematology Clinical Trials Unit runs between 10 and 15 actively recruiting clinical trials at any one time, with tens of patients receiving experimental therapies that they otherwise would not have been getting. And I've had quite a few wins with individual patients, quite a few really hopeful stories to tell.
I'd reached a point where I was going to go into full-blown multiple myeloma sooner or later. I had never been sick. I have never been sick since then, but I was going to be. As it turned out, my specialist said that there was a trial coming along. I was eligible for the trial. The clinical trials actually put the cancer into remission, which is much better than I expected.
What we want to move towards is our precision medicine. Traditionally, they've had either chemotherapy or radiation or surgery, and now we are introducing our exciting new immunotherapies. I also hope that looking forward that in our genomics service we can continue to offer our patients real-time genomic reports. In other words, we want to understand what's going on with these gene mutations in their blood so that those reports can come straight back to our doctors to help inform the doctors what treatment is best suited to that patient. And this is what we like to refer to as precision medicine. And I hope that our research program will not only continue but enhance the way that we can help our patients to have that real-time, personalised medicine.
Patients who've come to the Epworth have been amongst the very first and sometimes the very first patient to receive a new drug for their blood cancer.
When you're faced with the fact that you're going to end up with a disease pretty imminently in the next 10 years, or you've got this chance of trying something that's going to prevent that, I went for prevention.
When a patient joins a clinical trial at our centre, they get assigned an individual research coordinator who will be their go-to person throughout their journey on the clinical trial. We appreciate that we're likely to get the best outcomes when patients feel safe, that things are simple, and most importantly, they know who to call if and when there's a query or a problem. My biggest hope and dream for our patients is that they continue to have the option to try and to keep that hope alive.